Hi, everyone. It's DocTalk. Here we are coming up on Halloween. Great season. It is staying warm across a lot of the country. We have had extremes of temperature, particularly on the hot side across the country. But we've seen already the reports of snow and all of that in the western part of the country in the Rockies. That's great news for those people who live in the snow and whose lives are dependent on the snow, and for our environment where they need the snowpack for water for the next year. Here in Florida, we're recovering from the hurricanes, and in the Carolinas, it's been even more devastating. So let's talk about the effects of that for a couple minutes here. First, for those of you who've been to Florida, and even for some of our rescuers who were in Florida working, they were advised about wound infections occurring related to their work down here. There's reasons for that. We have within the Gulf waters organisms that grow in the very warm waters that are part of the Gulf of Mexico now. The water temperatures in some areas are over 90 degrees. And that breeds certain types of bacteria and other organisms. And generally, they hang out in places that aren't in contact with humans. But when hurricanes hit, they stir up all the waters, they push them inland. They get associated with other things in the water, including a lot of housing materials and nails and sharp edges. And then people who are in that water before it recedes back into the Gulf and, if you will, gets cleaned back up again, people are exposed to both sharp objects and bad bacteria and other organisms, and they can get significant wound infections, even from very little wounds. And so we have had rescuers who were down here who were in water doing rescue work, and then they developed infections, and these started off as very minor looking infections and then can get much worse, and actually can result in them having amputations of part of their skin and other tissues, and even amputations of their extremities if they have underlying wounds. That also is our native Floridians who are in the waters and sometimes around their homes and other things. And every day they're in the waters down here and don't have any problems. But when the hurricanes churn up the water, mix it in ways that it is not usually mixed, that can result in bad things happening. And so a timely issue for those of you who have been down here. We have cleared most of the waters at this point, including where I live. We just got a report today that our waters are no longer harboring bacteria that come from septic tanks that have been disrupted and from a lot of kills of fish and other wildlife that were killed in the hurricane and other things. So we're getting our waters cleared. And for those of you planning on vacations in coming weeks, you will be fine. But if there's local warnings about water and being in the water, please take them to heart and follow them so that you don't end up with these infections. All right, let's talk about a second big implication of our hurricanes. There are a lot of manufacturing plants up in the Carolinas. One of them that is very important to this country was hit by Hurricane Helene, by the heavy moisture associated with that storm, and where there was 2 feet or so of rain. That washed out a lot of roads. It flooded and killed a lot of people. And God bless those people that lived there and never would have thought something like this would happen. But one of the implications is it took out one of the manufacturing plants that makes many of the IV solutions that are used everywhere in the healthcare system. Physician offices, outpatient surgeries, hospitals, and in our ambulances and fire department trucks, and all of the other elements of the healthcare system. As a result of that, we have a shortage of IV solutions that are used for all of the things that we need sterile bags of salt water available for care. For those of you with dialysis needs, many of the dialysis machines at home and in the clinics are powered by some of these cleansing solutions. and they're not available. And you probably have been notified by your physician or the clinic about what they're going to do to manage the shortages. For those of you who have had surgeries planned for a while across the country, we are now canceling elective surgeries because we don't have the fluids that you would need in the operating room to provide care for you, either in your veins or flushing out the areas that the surgeon is working on. So this is a nationwide problem because that plant produces IV fluids for the entire country. This is not specific to the Carolinas. This is all the way to people in the extremes of the United States. This is the third time in 10 years that the United States has faced a shortage of intravenous solutions. There was a manufacturing problem that occurred 10 years ago. And then 7 years ago, there was a hurricane that hit Puerto Rico that wiped out the plants down there that produce our IV solutions. And now this one. It points to the very extreme nature of weather and the way our manufacturing is set up now, where we have very few plants that are producing critical products that we need, including things as simple as a bag of salt water or a bag of sugar water. One of the products of this plant in North Carolina is the resuscitation fluid that we use for diabetic patients whose blood sugars have fallen too low. So diabetic patients may have been told by their physicians, this is not a good time for you to have a reaction to your insulin and have your blood sugar go low because we're short on those solutions. In some cases, we have some stocks of these solutions, but these are not manufactured in a way that allows them to sit for months and months and years on a shelf somewhere. So there's a lot of just-in-time production of IV fluids, and we don't have big stocks in many places. So if you are a patient getting care in a health system, somebody's going to tell you we're short on solutions, and we're going to try to use other things in place of, or not have to use any IV solutions at all. Or for some of you who had surgery scheduled, elective surgery scheduled, you may hear that your surgery has been canceled related to IV fluid shortages. So that's the explanation for it. It is an unfortunate occurrence. We need to continue to plan better in this country for our very vital products that we need in the healthcare system that are as simple as this is, and make sure that we have redundancy and resilience built into the system. Nonetheless, we're gonna make it through this one as we have the past ones. We're gonna get through Halloween. Be careful with the little ones out there on your trick or treat night and other events related to Halloween. The biggest thing that we see, unfortunately, is these poor little kids who fall down in these costumes and break their wrists or bash their faces or other things. Be careful with those the poor little ones walking around at night in those costumes, that they don't have something that is a physical injury related to that. And then, of course, there's always the issues around food safety. So Halloween, we're making it through. We're, again, not looking at any big infectious disease outbreaks, but talk to your doc about immunizations for flu and COVID and RSV going into the winter months. We're getting to the point where we'll get those immunizations out. So take care of yourself. This is DocTalk. It's Halloween time. Have a great season, and we'll talk to you in 2 weeks. Thanks, everyone.